Hello, my name is Paul Horn and I'm an orthopedic hand surgeon. In this video, we're going to discuss wrist arthritis. Arthritis is a general term which describes any sort of damage or destruction in a joint. Patients who have wrist arthritis describe pain, swelling, and loss of strength. The evaluation usually begins with a physical exam and an x-ray. The x-ray gives us information about the severity of the arthritis and where the arthritis in the wrist joint is located. You can see that the wrist joint is a complicated joint. Here we have the radius and the ulna. These are the carpal bones. The carpal bones undergo a complicated three-dimensional rotation when the wrist is moved. When the joint does wear out, it frequently begins in this location and progresses around the wrist. Once we've made the diagnosis, the treatment initially consists of bracing. If bracing is not successful, steroid injections can be used. The steroid injections do not repair the arthritis, but they can diminish inflammation, and in some patients they're very helpful. Usually we are limited to 3 injections in any one location. If these measures are not helpful, then we can consider surgery. What surgeries are available depends in large part on the severity of the arthritis. In some patients, the arthritis is so severe that the only surgery we can consider is a complete fusion of the wrist. This x-ray demonstrates a wrist fusion. You can see that there is a metal plate and screws that span across the joint, and the bone has essentially healed together to form a single bone. The goal of this surgery is to relieve pain, but obviously we do that at the expense of motion. Patients can usually still rotate the wrist, but there is no up or down or side-to-side bend. In some patients, when the arthritis is not as severe, we can consider other procedures. One option is a partial fusion. This is an x-ray that demonstrates a partial fusion. You can see that the bone which was most affected by the arthritis has been removed and that the remaining bones have been fused together with this screw. This surgery, when successful, will usually relieve the pain from the arthritis, but patients always have some residual stiffness. This is a typical arc of motion for patients who have a partial wrist fusion. One risk with this surgery is that the bones will not fuse together. This is particularly a concern in smokers, and I generally do not offer this surgery to smokers. Most patients are casted for 6 to 8 weeks after the surgery, and then they begin gradual rehabilitation, but it generally takes 3 months before we can allow patients to utilize the wrist for any sort of significant grip or grasp. Another option for patients with arthritis is a proximal row carpectomy. With this surgery, we do not attempt to fuse the bones of the wrist. The goal of this surgery is to remove the arthritic bones, which leaves the distal row of bones. One of the nice things about a proximal row carpectomy is you don't have to worry about the bones fusing. The period of immobilization is therefore less. This x-ray demonstrates a proximal row carpectomy. The final recovery in terms of motion and strength between a proximal row carpectomy and a partial fusion is pretty similar, but in my experience, I would say that the proximal row carpectomy patients do tend to regain a little more motion, while the partial fusion patients tend to regain a little better strength. One final option for wrist arthritis is a wrist joint replacement, similar to a hip or knee replacement. This option is generally reserved for patients who are very low demand. In other words, this would be a patient that does not perform any sort of heavy grip or grasp. This is because the implants that are used for a wrist joint replacement tend to become loose in patients who are still active. For more information on wrist arthritis, please visit our website. Thank you for choosing Northwest Orthopaedic Specialists for your care.